Hello everyone, Dr. Fink here. Today we'll talk about managing blood pressure in bodybuilding. So quick disclaimer, this is not medical advice, this is for entertainment purposes only. So bodybuilding can be healthy, but it can also be very unhealthy, depending on the way we conduct bodybuilding. Okay? So bodybuilding, the goal is to increase body mass while decreasing our fat mass. So if we increase our body mass, no matter if it's fat or muscle, it will increase the burden on the cardiovascular system. Let's say you are 160 pounds and within 2 months you are 180. So your body is used to 160. Your heart, your whole cardiovascular system is used to that weight. Even though you put on 20 pounds of muscle, your cardiovascular system will have a hard time catching up with that extra burden on your body. So body weight is extremely harsh on blood pressure, no matter if it's fat or muscle mass. Okay? Especially for those who are taking performance enhancing drugs, anabolic steroids, growth hormone, insulin, etc. Weight gain can be very fast, and the faster those weight gains are, the harder it is for the cardiovascular system to adapt to those new numbers. Okay, and especially if somebody's taking anabolic steroids or growth hormone, water retention also plays a role. Okay, those drugs tend to make people retain more water, and what does water do in your body? If you retain more water, it will put more pressure on the blood vessels. Okay, so this goes hand in hand with excess sodium intake. So when somebody is taking too much salt, it is all a vicious cycle. So we're trying to put on more weight, we eat more salt, we retain more water, body weight increases, and all those factors contribute to putting more strain on our cardiovascular system. Okay, so salt also makes us retain more water, and those water retentions in combination with increasing body weight can be very harsh on our blood pressure. Last thing is red blood cell increase. So for those who are taking anabolic steroids, especially let's say Trenbolone, Nandrolone, Anadrol and such, the increase in red blood cell can be very harsh. Those drugs can even be used for the treatment of anemia, which is low red blood cell count. Equipoise is also notorious to increase red blood cells tremendously. So what happens if somebody with a normal, a person without anemia takes those compounds? Well, the hematocrit will increase tremendously, and the blood will become viscous. Okay, so it will be hard to flow, and this can cause clots and cardiovascular problems. And if you combine that with high blood pressure caused by the increase in body weight and the water retention, this can be a very dangerous mix for your cardiovascular health. So what can you do to prevent that? Weight gain should be slow and steady. Avoid gaining excessive amounts of weight in short periods of time. This is usually done when people overeat and then they gain fat. Try to limit your body weight gains in lean muscle tissue without excessive amounts of fat, so you can really let the body slowly adapt to the new weight. Nutrition: avoid excessive sodium salt intake so you don't retain excessive amounts of water, and doing so you will also help with regulating your blood pressure. Performance enhancing drugs: if somebody is taking performance enhancing drugs, so again, I don't recommend anybody to take performance enhancing drugs. They are detrimental to your health for the most part. But if somebody is taking those, they should make sure that the compounds they're taking are not too harsh on their blood pressure. Again, there's genetic and individual differences on how people react to those compounds, but usually compounds like trenbolone or equipoise, etc., will cause water retention and the increase of red blood cells, which can increase blood pressure. So staying away from those compounds can also help you regulate your blood pressure. Lastly, if somebody has a high hematocrit, high red blood cell count due to anabolic steroids or other reasons, it could be beneficial to periodically donate some blood, so your blood gets thinner and your hematocrit count might go down a little bit. Again, blood pressure is very important, and blood pressure, unless it is very high, does not have symptoms. So we don't feel pain, or we don't know that we have a high blood pressure. And sometimes people in bodybuilding, they get bigger and bigger and they don't monitor the blood pressure. But with the high blood pressure, this can lead to cardiovascular diseases, but it can also damage the kidney tremendously, especially in the long run. That's also why it's called the silent killer, okay? So the more pressure there is, so remember the kidney filters the blood, so the more pressure the blood is coming into the kidneys, the worse it is for the kidney. And if that continues for a long period of time, this can cause liver damage. So please, if you're bodybuilding, make sure you monitor your blood pressure. If your blood pressure goes high, make sure you can pinpoint what is the trigger of the increase in blood pressure, and make sure to address that cause of raising your blood pressure to prevent cardiovascular or kidney diseases in the long run. I hope this video was helpful, and I wish you a wonderful day. Thank you for watching.